Welcome to Access Amplified, the podcast where we shine a light on how digital health is increasing access to care and advancing equity around the world. I'm your host, Joanna Braunold, and our podcast is brought to you by TytoCare. In each episode, we sit down with healthcare leaders who are doing the work on the ground to reimagine access and rebuild it from the ground up. And today I'm joined by Lacey Finkbeiner, Clinical Informatics Specialist at Horizon Healthcare. Welcome, Lacey.
Hi, thank you for having me.
Thank you for joining us. So a little bit about Horizon. Horizon is a federally qualified health center serving rural and frontier communities across South Dakota. Obviously, distance, broadband, and workforce shortages are daily realities and challenges there. Lacey brings a unique perspective on how digital tools, hybrid care models, and school-based programs are helping Horizon to deliver high-quality care across some of the hardest to reach places in the country. And we're going to dive into some of those today on how Horizon are doing it and how we can learn from some of the work that they're doing. So let's dig in. Lacey, as we mentioned, Horizon covers vast and often remote areas of South Dakota. How do you define access in this context? And what does it really take to make sure your patients can get the care they need?
Horizon, we're very rurally focused, and we cover a vast service area across the state of South Dakota, featuring 20 primary care clinics, 7 dental clinics. We actually cover 28,000 square feet miles. Our footprint is pretty big across the state.
Wow. Yeah.
Offering 3 different service lines to our community. So we offer primary care, behavioral health, and dental. We invest in presence in our communities, and our care teams work to build that presence and that trust and that supportive relationship by being active members in each of our communities and engaging in any opportunity they can to work closely with other businesses, schools, et cetera, with those communities to develop that relationship. Knowing that many of our communities are more than an hour's distance from another hospital or emergency room or another even medical facility, we strive to offer that open door for the greater good for our communities and provide that patient the bigger services and that access to care. We offer that leading edge technology to offer like telemedicine capabilities, working with our providers, especially virtually anywhere in the country. Essentially, we work with 3 different big healthcare players in the other state of South Dakota too to offer specialty services, in addition to urgent care services, and emphasize really in primary care and that whole health medicine and wellness throughout the life, and try to offer that the whole picture for our patients and allow them to have that access right at home in their own community.
Right. So it sounds like it's really a combination of some on the ground where you can in the specific communities, and then that digital element. Can you share how digital tools are helping your providers reach those communities, especially if, as you said, there is kind of like an hour to the closest hospital? So how are they reaching those communities without the travel? How is that impacting patients and the clinician? I assume it has an impact on the clinicians as well.
It does, and we know that staffing is very difficult in rural frontier areas, especially where I am. We're in a community of 125 people, rather small, so very difficult to recruit and retain providers that normally don't grow up and come from here. So we utilize telemedicine to provide that staffing coverage for our rural frontier clinics. If a provider is out sick or out on CE or extended leave, or if we are short staff in a clinic, say a provider is no longer working there, we utilize that telehealth coverage, provide services to that community. We do have a clinic in Bison, South Dakota that is staffed by 2 nursing staff and a receptionist, where their provider coverage is primarily telemedicine. The provider does go there 2 physical days a month also, but pretty much they do everything via telehealth. On the dental side of it, too, we offer teledentistry as well throughout the state. We have a shortage with dentist staffing and such. If the hygienist is able to present that patient to a dentist from another site, we're still able to keep that patient compliant with their routine care and keep them on schedule for their visits too. But this allows us to keep those providers in their home clinic and also eliminate that extra hour of travel. So a lot of our clinics, between traveling to them, is an hour drive,
Wow.
one way.
Okay.
So to keep them home in their main clinic and provide that access to their home community and allow them to provide that care for a rural community that's an hour away too. Seeing the best of both worlds and allowing patients to be seen and get the care that they need, so they don't have to drive to 2 hours away to urgent care or sit in the emergency room an hour away for 5, 6 hours.
Right. Right, for sure. And so, like, let's take that Bison clinic as an example. So you've got a receptionist there, you said, and you've got a couple
Mhm.
of nursing staff. And then what they do is they connect with a provider who will be sitting in their local clinic. Okay. And how does that work? Like, how do you balance appointments, busyness? Do they book appointments with that remote provider, or do they just kind of show up? How does that work?
Nope, they book appointments, so they'll call in, and we have access to all the schedules across the organization, and we've got a group of 7 different providers in Horizon that provide acute telemed services. And
Okay.
then we do have one provider here in Isabel, which is the clinic I'm in, who covers solely in Bison. So that staff will routinely keep her schedule up. So they'll call and they'll work closely with the receptionist in the Isabel clinic and as well as her nurse here too, to see kind of what her schedule looks like throughout the day and see where they can kind of plug and play with those patients. So they can double book and allow her to room here in Isabel while the nurse is rooming here. She can connect to a patient in the Bison clinic, get them seen and kind of have the best of both worlds. So they're both kind of equally utilizing that schedule and that availability for her to keep her day busy as well and allowing us access to those communities.
Okay. So it's really like maximizing clinicians' time whilst also giving patients
Hmm.
the opportunity to see a clinician without having to travel, as you said.
Yes. Yep.
And you've mentioned, I mean, we've spoken before, and I know, especially where you're based, some of the tribal reservations have better connectivity actually than the nearby
Hmm.
cities.
Hmm.
And obviously, connectivity is a huge challenge when it comes to remote care, when it comes to telehealth. How has that shaped your rollout? Like, and what lessons have you learned from those differences? And it's funny because usually we think rural, bad connectivity, city, good connectivity. But you've mentioned to me that sometimes it's the other way around.
It's the other way around. Yep, it's the opposite. We actually operate on 6 of 9 Indian reservations in South Dakota, and many of our locations are extremely rural, and access to broadband is very difficult, and it is a challenge. But some of our clinics have recently gained fiber optic connections since we started even rolling out our EMR in 2010. On those reservation areas, we've been fortunate to work with and partner with rural and tribal telcos to expand the fiber access, improve bandwidth, strengthen the connectivity for both our clinics and our patients. So they're able to connect from their home to our behavioral health team with that fiber access, with that expanded wireless connection and whatnot, too. We've even had the ability to amp up our wireless connection and be able to support more connectivity units in our clinics to connect those patients to our behavioral health providers or our telemedicine providers too. Even since our beginning of telemedicine and Horizons adventure in the early 2000s, it's grown so much from just a single connection to how it's expanded so far with the 3 service lines.
Yeah. And is that something that you've been able to work directly with the telcos to set up? Or is that something you've had a hand in?
Yep, through lots of different grant programs and funding opportunities through USDA has definitely helped expand and grow the opportunity to build our bandwidth programs and work with the local telcos. And like right now in the area I'm in, they're actually digging a new fiber line. So it's been exciting and it's our second round of that since 2010. So it's been exciting to see that develop and grow and allow that access because without technology, we know that things are a struggle in today's world. So we can't chart, we can't do certain things, we can't run labs. It controls so much. So we need that extra power to see our patients and have that to keep care going as well in our communities.
And I think it's kind of interesting that as an organization, right? Me as like Joe Braunold stuck in an area with low connectivity, I can call the telco all I want, but like
Yeah.
they're not going to care so much. But a health system or an FQHC or an organization who's saying, no, actually, we need this for healthcare purposes. We need this for something
Mhm.
very specific. I'm assuming that that kind of helps to push things through. And then, of course, there are the peripheral benefits for the community of that additional access as well.
Yes. Yep. And actually, probably going on probably 5, 6 years ago now, we worked closely with a few of our telcos in our communities to upgrade our telemedicine equipment as well. So they actually helped donate and raise money and worked with our foundation to purchase new telehealth equipment. And that's kind of where the title care ballpark kicked off. So back when COVID started, it was perfect timing. So they knew we needed that access. We knew we needed that equipment to be able to see the patients on demand. It was great. They were excellent to work with. And now those communities get to see it firsthand, and those individuals maybe our patients, they get to utilize that service right there, and they know that they can keep it right at home. So it's the best of both worlds being able to work together.
Amazing. I love that benefit that comes for healthcare and then provides even more to the community as you're working through it. So, in those cases where you are working with communities, whether they're um, rural or more urban centers that have limited internet access, or maybe even the patients or the community has low digital fluency, what
Mhm.
types of patient support, so whether it's like training, devices, community outreach, what have you seen make the biggest difference?
With the access to healthcare also comes the challenge to accessing the technology. So many
Mhm.
of our rural communities we've noticed over the years that our virtual program has grown from single care to a specialist to the broadband network to clinic home visits, clinic to clinic visits, specialty consults, et cetera, and so forth. So, with COVID coming around, one thing we really learned was the importance of strong communication and outreach to our staff, even to our
Okay.
patients and our communities about the services that we do offer. Virtual care is now a cornerstone to modern healthcare. It's here to stay, and we're committed to ensuring that our teams are engaged, they're adaptable to the change, and they're prepared to meet the challenges that they encounter every day with it. And so to support that, we do a annual marketing campaign about our telehome program that we offer with our behavioral health team, routinely throwing that on social media, digital marketing. Same thing with our acute care, kind of with our peak season as we're kind of going into sick season right now. Similar situation, lots of social media around that access to care if your provider's out of your clinic. We do have that title care coverage to promote that so those individuals know that they can still come into the clinic if the provider's out to be seen for those acute needs. And then engaging in staff training with our provider champions. Annually, we host a staff training to ensure that the receptionists to the care teams are at the top of their game, learning the technology, using it hands on, and not losing that skill. So that way they're familiar if they do need to use it on quick demand, they can power it up and get things running. So we've really learned that kind of just keeping engaged with the whole process has really helped us to promote it and keep it going. And we know that even word of mouth on the street too, if we have a good patient experience, if we're sharp on our skills and the patient has a good experience, they're going to go down to the gas station and tell all their friends that, hey, look what I did at Horizon Health. This was great. I can do this here in the community. So word of mouth is the best form of marketing. And if it's a positive experience, it's going to engage the community, and we're going to get more out of the benefit of it. So
Yeah,
that's kind of
especially
what
in like
we've
a
learned.
small community like you're
Yes.
looking at there. Yeah.
Yeah, exactly.
And you mentioned providers. So obviously there is that element of kind of training the providers, making sure that they keep their virtual skills up, just as they
Mhm.
have to keep their medical skills up. But you also mentioned that recruiting and retaining providers is tricky. Obviously, we know that this is the case across rural areas in America. How has virtual care impacted that? Has it helped you to attract or keep talent? And I guess I'd especially be interested in behavioral health because I know that
Mhm.
they're even in more short supply in rural
Yep.
areas.
Yes, with our BH services, we're able to offer them remote work. That's been a huge benefit to our recruitment team. Our BH providers work, it's a bit of a hybrid schedule. We do have some that work on prem, we do have some that work mainly at home, and we do have some that work both. But it's allowed that flexibility for them to be able to be in their main community. Some of them are not working in the communities that we have actual house clinics in. Being able to hire those individuals on where they can specialize in their practice, yet see patients across the state in any of our clinics and be able to provide that service, even cross state lines. If they're licensed across state lines, they'll be able to provide those services that way too. So it's been a nice recruitment feature to be able to kind of hold and maintain those individuals and still allow that access to keep them at home, limit that driving, and still be able to provide those great services to all the individuals that we see.
I think it's so interesting, especially like behavioral health is something that should work so well virtually, but I think we kind of see it being underutilized as a tool for behavioral health. And it's very interesting because obviously we've spoken about this in the past about how you're leveraging it for virtual care and for behavioral health. People who get to live in these beautiful, remote, rural communities, be part of that community, but still not have to stress out about their commute to the nearest
Yep,
clinic or
exactly.
hospital.
Especially with the climate that we live in, we deal with rough winters and bad roads and, even in the summer, this year's been an unfortunate year of a lot of rain. We've been very fortunate to have a lot of rain and such, but it causes poor road conditions in different situations too, where folks don't necessarily have the means to travel. So it kind of have that perk for that too, where we do have that flexibility for those folks to
Yeah.
to
I was
remain
gonna
remote.
I was gonna I was gonna kind of ask about that because obviously where you're based, there's definitely some inclement weather, particularly in the
Oh yeah.
winter. Are you seeing, first of all, challenges in terms of arriving at clinics, even if they're the local clinic? Do you see like broadband dropout? Like, are there other challenges that kind of adds to your virtual work that even that becomes a stretch in those conditions?
Where we run into issues mainly would be when the power would go out.
Uh-huh.
Usually, if we do have inclement weather, the weather doesn't really cause a huge impact on connectivity and such, but we are so rural that if the electrical lines do go down or are packed with ice, that's where you do run into issues with electrical outages. And then, of course, that does impact care. We do have a drop to paper downtime process that we do train and work with staff on annually as well, which is next month, actually. So, October is our downtime process month that we work to train staff on. So, as we roll into November through April is usually what winter weather time in South Dakota. So we can get our teams up to par on what to do and handle those situations. So we're still able to kind of work to see those individuals if we can, especially in the clinic where virtual care may kind of struggle a little bit. But once it's up and running, we can try to get it going. Most of our clinics do have generator resources, which is nice.
Okay.
So we can still kind of function and see things. But for the remote workers, it is a bit hard. But if they can get into the clinic that is locally in their community, that's what they will
Then
do
they
for
can,
backup.
okay.
Yeah,
And then they can, I assume, connect through to wherever they need to connect to based from the rural.
absolutely. Yep,
Amazing. Okay.
yep.
Okay. You're describing my nightmare, by the way. Like, I'm a city girl and my husband wants to live in a village with like 10 people, and I want to live in like Manhattan. So,
We're
somewhere,
very much a village.
well, when the power goes out when it snows, I'm like, nope, that is not for me. Okay. Let's talk a little bit about operational elements. So you have in person, you have virtual, and you also have school-based services. How do you blend those together? How do you make it work seamlessly?
Providing access to rural school settings, especially with that particular school. So we do have a school-based clinic. The closest emergency room or closest clinic to them is 30 miles away. Even the closest pharmacy is 30 miles away. So many families in that actual community for face limited transportation. So we do house a nurse on site of that school-based clinic, and we do have a provider that goes there 1 day a week physically, but the other 3 days a week, so it's a 4 day a week school,
Uh-huh.
we do connect via telehealth to two providers in two other of our communities. So they're able to see those kiddos from the start of school, so usually 7:30 in the morning till about 4 in the afternoon. And those
Okay.
community members, teachers, staff members at the school, and community members, so they're able to provide that access. We do have some on-site limited lab testing and pharmaceutical
Okay. On
startups, so they're
the
able to
school.
kind of get them, yep, at the school, so they can kind of
Okay.
get them treated on demand there and get the treatment plan started so they can kind of get the course going while the mail gets them the medication a couple
Okay.
days later.
Okay. That's very cool to have the testing actually on site at the school as well, because we have other school programs we work with, and testing is a challenge. So that's a really interesting addition. And then how do you integrate that? So if somebody is that all set up within your EMR as well, almost as
Yes,
a clinic, so it's completely integrated in terms of documentation and
it is. Yep, it is.
okay,
Yep. Yep. And
great.
it's CLIA waived, so we offer, your strep testing, COVID testing, influenza, your baseline tests where you can work to kind of treat those on demand. And then if the during the telemed visit, if the provider sees that we need additional labs drawn or whatnot, we'll work to try to get that individual to the clinic in the community closest to them to have additional testing done. So
Okay.
yeah, we'll work with rural transportation to try to get them there.
That was going to be my next question is, do you provide transportation services in these cases where it's tricky for the patients to?
Not in this particular community, but we do in other communities, yes.
Okay.
Yep, but there is a local transportation agency through the tribe that we work with closely to arrange transportation to get those individuals in the community for the care they need.
Okay.
Yeah.
And how have you seen that impact younger patients within the community? Because obviously, oftentimes children don't necessarily have their own PCP. Have you seen like a positive impact on healthcare, especially perhaps within the reservations themselves?
I think just having that access and that place for them to go where it's kind of like a little safety net and when they need something, if they've got a cut or a little boo-boo or a bruise to look at, and they have that provider, that nurse to talk with and to kind of help them if they need to. And then they're keeping them in school as well. So if they can kind of sneak them out of the room to get their little owie cured and treated, and they can still go back to the classroom, that's the benefit of both worlds too. So they're getting their education and their healthcare taken care of as well. So
Yeah. And I also love the technical terminologies that we're using here with owies. And I
yeah,
think that
that age range of the kindergartners and the fun age groups, the little people, they're the best. That's what makes
they
it.
are the best.
That's what
It's
makes the
true.
experience. Yeah.
It's so true.
Yep.
Um, Okay, I wanna and speaking of, I guess, those patients and those owies and those stories, are there any can you share any moments or stories that really stand out to you as a place where digital health made the difference between a patient getting care or a patient going with?
Yes. Well, there's lots of stories, but one in particular that kind of hits home. We had a patient down in one of our very, very rural clinics that's about 3 hours away from specialty care, who needed routine care at a heart and vascular institute in Rapid City. Their care team reached out to the care team at our clinic, and this patient had transportation issues getting to that facility for
Mhm.
that routine care, labs, education, instruction on next steps. So they needed some back-to-back routine visits to kind of get through the treatment plan. So we worked closely with that facility to arrange virtual care so the individual didn't have a computer at home or a cell phone where they could connect to that specialist telemed platform with their EMR. So they reached out to us and we arranged using our telehealth platform to connect their provider to our team to allow that patient to come in. We used our transportation services to go get that individual and bring them into their clinic every couple of weeks so they could stay on track, get their tests done. What was nice was our reference lab, those tests actually go right into the same reference lab that the specialist uses. So they could see
Okay.
those results right away. But they worked closely with the care team in our clinic and were able to get that patient on track and allow that patient to stay in their community, get the care they need, and stay compliant, and allow the care teams to have the best of both worlds, essentially. And they were allowed to work together as a team. So you had two different organizations working together for the best of the patient and the best of the community. So
I was gonna say that's
I'd say,
to me is like the heartwarming takeaway of this story that
yeah.
and I think that that's as we've spoken with people on Access Amplified, a lot of the biggest success stories that I've seen are when it comes to partnerships like that, where, you might have like a bigger player and a smaller player, or you might have one organization that has some elements of the care that they can provide, and they partner with a transport organization or a telco organization.
Mhm,
I think it's definitely a huge takeaway to say, well, we might not be able to do all of these things ourselves, but there are other organizations in our area who are trying to solve some of the same challenges that we are, or at least who are trying to serve the same community that we are and want the best for that
mhm.
community. And then that's how we get to the best outcomes at the end of the day.
Yep, absolutely.
I hope. So, a kind of a question for you and about your journey now. You've been at Horizon Health for over 16 years.
Mhm.
What keeps you inspired, and what are you most proud of in the work that you're doing?
Well, my first role started as an FQHC right out of college. I began in 2009 at Prairie Community Health in medical records. Over the next few years, it was kind of like the evolution of the EMR. And I've always been a technology kind of junkie, I call it. I've always enjoyed offering that next bit of fun technology that patients could have to engage or providers could use to make their day go faster or more efficient, allow our care teams to have that next bit of fun. I don't, technology is fun to me. So when we merged with Horizon in 2016, Great Community Health and Horizon Health merged. At 2016, I got the chance to dive deeper into virtual care and learn its more potential and its impact on rural health and what we could offer in smaller communities of like Isabel, where I live, which we have 125 people, rather small. So having lived here my entire life, I know that it's difficult to access specialty care. We've got to drive 2 to 3 hours to see a specialist for a 30-minute appointment. We know that that's a struggle. So having the ability to see BH services, we don't have generally behavioral health services around here. It's even hard to
Mhm.
get dental care around here. So if we can use technology, telehealth, enhanced EMR, you name it, to offer that to our rural communities to get them the care that they need, or to offer that to our providers to be able to engage with other specialists and learn from them or seek their advice or their help or to collaborate on patient care, then that's what kind of helps drive me to build the program to make it better and keep it going too. So, and to keep our folks at home and allow them to stay in the community as long as they can for the next phase of their life. Being able to keep our community growing and allow that access to our rural community to keep them functioning and working together too. That's definitely kind of what drives me with the program.
I think that's a really special goal, and it's an amazing way to work towards achieving that as well. Thank you so much for sharing, and thank you for
Yeah.
joining me here today, Lacey.
Yeah. Thank you for having me.
Thank you. And if you did enjoy today's conversation, please be sure to follow or subscribe wherever you get your podcasts. New episodes drop every 2 weeks. And please make sure that you share this episode with a colleague who is passionate about digital health access or rethinking care delivery. Access Amplified is brought to you by Taito Care. I'm Joanna Braunold. Thank you so much for joining us today.